Hey guys, it's Dave. Today we're going to talk about something that we're actually seeing more of. I honestly don't know why. It may be the fact that we are seeing more staph infections due to cleanliness, due to we're seeing a lot more procedures done too as well, which could be part of it. We've got a lot more hips, knees being done as these surgeries are more commonplace. They're more affordable now, and we got more people like me that did something in their younger age that we bit the bullet, and later on we're paying the price, so let's get something done about it. Condition I'm talking about is cellulitis. It's a bacterial skin infection. It causes the skin to become discolored, generally red or pink, but depending on your skin tone, it can actually look like a dark bruise as well. So that could be the case that's going on with it. It will be hot, tender to the touch, and painful, as two things can occur. Number one, the infection causes pain itself. The other thing is your skin can be more sensitive to touch, which can cause the pain too. It can occur anywhere on the body, but the most common areas that it's seen is in the legs and the feet. Okay, it can also become life-threatening. So if it does occur, you are seeing some signs and symptoms that I described, you do want to go into your provider, especially if you've had one of the things happen that can lead up to it. The symptoms, like I said, you can see pain, you can see an increased temperature like a fever, you can see increased temperature on the skin itself. If you rub your skin, you go down in that area where it's red, it is warmer to the touch than other areas of the skin. It's a rash and it will spread. In fact, one of the ways that they can tell you how you're accepting the treatment, which is antibiotics, as well as if it is cellulitis, they'll take a Sharpie, and in that area where that rash is, they'll draw around the outside of the rash. And then the next day when you come in, if you're on antibiotics, that rash should be getting smaller. Or if they're trying to decide if it's cellulitis, that rash may be outside of the black Sharpie. So that's one thing that you can do, and one thing that your provider may do. Don't freak you out. He's not coloring like in kindergarten. He's actually doing something to tell if the treatment that they're doing is working. Some of the other things that you can see is tightness in that area, especially if it's a bigger area like your calf. The skin will become tight, maybe a little bit of weeping through the skin as the infection is spreading. You can see fatigue, dizziness, shakes, lightheadedness can occur, lethargy or just no get up and go, sweating, as well as chills. That can all happen. Staph or strep is where, like I said earlier, is the most common culprits with that. And what it's actually caused from, it is, like I said, a skin infection, but if you have a break in the skin or a puncture, maybe you stepped on a nail and you've already got your Tdap, which hopefully you do. Of course, if you step on a nail, you don't have it, get your Tdap. But if you step on something and cause the skin to break or a puncture, a serious bite from an animal or even a bug like a spider bite can cause it. If you've had any scrape, you fell down, scraped your knee on the sidewalk, that can do it. Or if you've had a procedure like knee replacement, hip replacement, or laparoscopic surgery, anything like that can make you more prone to it. Some of the other risk factors that you will see is patients with weakened immunity. If you've got another infection going on, if you have going through cancer treatment, if you have HIV, those will weaken your immunity, make you more prone to having cellulitis. If you're a diabetic, if you have eczema, or any immune reaction that you may be seeing, like with lupus, something like that, you're going to be more prone to it. If you happen to have athlete's foot and you have something going on with your feet, like a break in the skin, that's going to make you more prone to having cellulitis, as well as obesity or lymphedema, which I've discussed in a previous YouTube video as well. As far as treatments, what they'll treat you with is over-the-counter pain meds for the pain that you will occur with that from the swelling that goes on, as well as oral or IV antibiotics, depending on how serious of an infection it is. The antibiotic treatment, generally you're going to see it's going to last 5 to 14 days. Some of the other things that you can do just to help out, if you elevate the site of the infection, that will help out with the swelling. And then the worst case scenario is if you actually have an abscess, they may want to do surgery to clear that up faster than treating with antibiotics. As far as complications, if you don't go in, you try and just let the infection go on its own, you can develop gangrene, which is tissue death. If that occurs, you can see amputation, you can see sepsis, which is a systematic infection that can lead to damage to internal organs and death. So you want to take this very seriously. As far as prevention, you happen, like I say, to fall down, you scrape up your knee, or you have surgery. You want to make sure that the wound is kept clean. Antibiotic ointment and covering it, unless otherwise instructed by your provider, is the best thing, as well as changing your bandage every day and keeping the site clean. Okay, some cases you may not be able to shower if you've had surgery. In that situation, keep it as clean as you can around the area. Talk to your provider if you see any changes in that cut or surgical area, or if you see the rash that's spreading. Get into your doctor right away. The other thing that you can do just on a daily basis, use a good skin moisturizer. I recommend CeraVe. I like that one a lot, but there are other ones out there as well, just to keep your skin healthy. So if you do happen to step on something or get a cut, you'll recover faster. Remember, it will not go away on its own. It is an infection. You need to be treated with antibiotics. So don't wait. Get in, get treatment. You'll recover faster and you'll respond better.